Hello, everyone, and welcome to Ortho NorCal Educational Webinar Series. My name is Leah Rutinov, and I'll be the moderator for today's webinar. It's going to be a quick follow-up to the webinar we had last week with Dr. Blue, and then Dr. Blue will be demonstrating some shoulder exercises that you can practice at home, and the exercises will be recorded, and recording will be available on our website under webinar section. Dr. Blue, it looks like you're all ready to go.
I am. Thanks, Leah.
Yeah.
All right. Welcome, everybody who's ever out there, our patients. This is sort of by request. We had a lot of questions on our shoulder talk last week, and I wanted just to really go over some of the main points of the things that I discuss with patients in the room. And I truly tried to make this simple for everybody. So this is an exam room. This is where we typically see things. The lighting's not perfect. It's not a studio. This is my computer. It's not professionally done, but I really wanted just to come to you face to face and really just talk to you about some of the things that I think would be helpful. One of my favorite quotes is, I stand on the shoulder of giants who have come before me. And really, this is from my learning over the years from our patients, from our physical therapists, from other physicians, from cases, and from things I've read. So really, none of this is mine per se. I didn't invent any of this, but I found that really all this is helpful for our patients. So just a quick review about the shoulder. We spoke about this in our webinar, but the shoulder is the most mobile joint in our body. We can really put it anywhere in space. I don't have the range of motion I had when I was a kid, but we should be able to touch anywhere in space. And because of this amazing mobility we have in the shoulder, we lose stability in our shoulder. So we're really reliant on the soft tissues to help with stability. And another one of my favorite quotes is, you really don't appreciate the shoulder until somebody takes it away from you. And if anybody's had a shoulder problem, they've lost range of motion, they've lost strength, you really appreciate it. You can't do basic things like wash your hair or put your clothes on or even pick up a cup of coffee. Again, the shoulder's super important. You don't really think about it until something happens to it. So just a quick review. We have just some bones that make up the shoulder here. We have our upper arm, this is our humerus. We have our scapula, which is our shoulder blade, and we have our clavicle. And in between here are the joints. The main joint we're going to be talking about today is the glenohumeral joint. It's the joint between the scapula and the humerus. In terms of range of motion, if you look at your shoulder, again, your shoulder blade by itself moves on its own, and it does things. Why don't we do this together? If any of you are watching, and I don't see anybody, but I assume you're out there, let's all do this together. If you can kind of put down what you're doing and just kind of follow along with me, I think this would be great. I'm going to extend forward with my arm, and my shoulder blade is going to come forward. I'm protracting my shoulder blade forward. Likewise, I can do a rowing motion and retract my shoulder blade back. So I'm going to push my shoulder blade back. I can push it forward. Those are two basic movements of the shoulder blade. Same way, I can do some shoulder shrugs and shrug up, and also shrug down. Those are basic movements. My shoulder blade's moving, and I can do all four together. I can protract, retract, shrug, and depress. So get to know those motions with your shoulder blade. I think it's important that you be able to control that, and those are exercises you can do while you're seated at your desk. The other parts of the motion of my shoulder are, I can elevate my arm in front of me. I can extend my arm behind me. I can reach across my body in adduction, and I can bring my shoulder up in abduction. And I can also rotate my arm. This is internal rotation. This is external rotation. So your shoulder is very mobile. And a lot of movements that we do, such as throwing a ball or hitting a tennis ball or swimming, involve all these movements all together. If you look at me here, I'm sitting in this chair, and I'm sitting like this, and I'm hunched over. This is a typical position we see a lot of our patients. Our shoulders are hunched, we're contracted in the front, we're extended in the back. We're also sitting, you can't see my hip flexors, but they're down here. I'm sitting in this position. And it's a typical position that we're in most of the day. And this is not great. We need to work on the motions that are just the opposite of this. So our hip flexors, because we're not talking about the hips today, but we got to work on hip flexor stretching. But for our back, because we're hunched over, we really need to work on exercises that help strengthen our back, our low back and our upper back. So if we can do just the opposite, and we'll go through some of those motions today, that would be wonderful, especially for those of us that sit, and most jobs are now on a computer, so a lot of us spend lots of time doing this. Couple tests that we can do. Let me just show you one good test here that we do for our patients. Actually, I like this one here. I'm going to move over here to this part of the room, and you can do this with a, I have a towel here, but one thing you do is just put your arms above your head. If you guys want to stand up, or if you're in a chair, just kind of reach overhead and kind of keep your arms up. You should be able to come to full height here. And then one thing I'm going to do, I'm going to lower this here a little bit. I'm going to see if I can get in front of this wall here. I'm going to keep my arms up, and I'm going to try to do a full squat right in front of this wall while I keep my arms here. And I should be able to come down and keep my knees by this wall and be able to stand up without my hands touching the wall. Another way to do this is I can grab a dowel. This is just a light dowel. You can pull this out of your closet. And same thing here. I'm going to get down a little bit low here. I'm going to keep my arms here, stand about 6 inches from the wall. And I'm just going to kind of squat down. And this requires really good hip and back strength. But you can see the dowel should not hit the wall. It shouldn't come over here. It's a great test that you're moving completely. I'm going to move this back here. Sorry about this. Let's go back to my chair. So if you can do that motion with your shoulders and squat down with your arms above your head, it's an effective test that you're able to move your hips and shoulders pretty well. So I'll go through 4 things today. 4 things. One is properly. How do I lift so I don't injure my shoulder? So the best way to look at this is to look at your elbow and see if your elbow is coming way behind the plane of your body, like this, and if your elbow's up high. Your shoulder, the most inherently unstable position of your shoulder, is when your elbow's high and behind the plane of your body. So any type of lifting that I do that involves this can be a problem, and it puts a lot of strain on the anterior part of my shoulder. So let's look at a typical push-up. If I'm doing a push-up or a bench press, I come back and forth like this. I come way back behind the plane of my body and my elbow's up high. Same thing with an incline press. If I'm laying in a bench and I'm doing an incline press, my shoulders, again, come behind the plane of my body and they're up high. Other exercises similar, military press. I'll use my dowel here, but if I'm doing a military press and I'm coming down behind my head like this, this puts a lot of strain on the anterior part of my shoulder. Again, my shoulders are up high, my elbows are up high, and they're behind the plane of my body. Flies, dumbbell flies, you come out your chest. A lot of times people will come way back behind the plane of their body. And what you're doing is you're forcing your shoulder forward. Pull downs, another one. You take a pull down machine and you pull down behind your neck, or even down here. Again, elbows up high and behind the plane of your body. And one more exercise, dips. If you do dips, when you do the tricep extension, again, the elbows are up high and behind the plane of your body. What I recommend is if you're having shoulder problems, take each of these exercises and make it healthier. So in other words, if I'm doing a push-up out here, watch the position of my elbows. Bring it down in here and do the push-ups with your elbows a little closer to your body. So again, elbow instead of behind and up high, closer to my body. A lot safer for my shoulder, and you don't have to come down all the way. Same thing with incline press. If I have an incline press, same thing. Got to keep my elbows here versus out here. It's a lot safer for my shoulder. Military press. I always tell people, if you're going to do a military press, kind of lean back a little bit and keep it in front of you. And you can see the position of my elbows, it's in front of the plane of my body. It's a lot less strain on your shoulder. Pull down, same thing. Instead of back here, which you should never do, pull down in front of you. And again, the position of my elbow determines how much strain is on my shoulder. Flies, you don't have to come down past the point of where your chest is. Anything past that, you're just stretching the front part of your shoulder. You're not really working the chest muscles like you need to work. And dips are tough. You can do probably a partial dip, but if you come down too far, I think it's going to strain your shoulder. So the most important thing is proper form. Look at the position of your elbow. Behind and up high is bad. A little bit closer in here should put a lot less stress on your shoulder. Another point we talked about last week in our webinar is proper form with your sport. if you're going to perform your sport incorrectly. And this is where form, practice, and a coach, and even videotaping is really important. If you're serving a tennis ball and you have incorrect motion, or you're cheating with your elbow, or you're leaning back, it's going to put a lot of strain in your shoulder. So proper form in your sport is super important. And most importantly, listen to your body. If you're getting pain, you're sore after playing, something doesn't feel right, your shots are weaker, your body's telling you something. It's telling you that you need to listen to it. You need to slow down. So that's really, what I want to say about proper lifting. Let's talk about range of motion problems. So you can have a frozen shoulder, you can have impingement syndrome. If everybody wants to just kind of put their hand on their shoulder blade here and kind of hold down like this so you can't cheat. So we do this in the exam room with patients. Just push down here. You should be able to pick your elbow up. As long as you hold this down, you should be able to pick your elbow up to 90 degrees or 100 degrees. For those of you that can't get past that, if you get to about 70 degrees, you may have some shoulder impingement. Again, hold this down, pick this up. You should be able to pick your elbow up. Likewise, in this position, when I'm holding here, try to cock your arm back. You should be able to externally rotate your arm. This is the throwing position. This is the hitting position for tennis, but you should be able to do this. If you can't get to 90 and you can't cock your arm back, you may have impingement syndrome, which is a loss of range of motion. Let's go through some of the exercises that you can do if you have range of motion problems. And I'm just going to kind of walk through this. Again, pardon our room here, but I'm going to do my best. Here's the corner of the room. And what you can do is you can get into a corner of a room anywhere and put your arms up here and just try to lean into it. This is going to be a really good stretch for external rotation of my shoulders. I'm just leaning in and having my arms go back. It's a great exercise for external rotation. Likewise, hopefully nobody's in the hallway. They're not listening to me here, but you can get your arms up on a door. You can hang and lean forward. Again, this is a great exercise for stretching my shoulders. I had one patient who had really chronic impingement syndrome. He really needed surgery. He absolutely refused. He said, I don't care, I'm not having surgery. And he did this for about 6 months, and he was able to kind of really fix his shoulders. He literally just hung from a door the entire time. So super effective exercise. Another one, let me go grab my towel here. You do this with a towel. This is a short towel. And again, I don't have the range of motion I had when I was a kid, but put this down here and then look, you grab your hand here, and I'm going to pull up. I'm internally rotating my lower arm. I'm pulling up and stretching my shoulder. Likewise, I can also pull down on the other one, and that's working the external rotation on this side. So again, working a towel to work on your range of motion, your shoulders, is super effective. Let me grab one more here. I'm going to have you guys come over here. Enjoying this around the exam room here. Very nice. Okay, so I'm going to go over to the table. Another one is I can do an extension stretch here. I can get on a table or I can get on the floor. And I'm letting my shoulders come behind me in shoulder extension. I can kind of lean into this. And this is a great stretch for shoulder extension. Last one is one of my favorite stretches. I'm just going to kind of show you on the exam table here, see if this works. But this one is called the sleeper stretch. And if you lay on your side, let your arm come out right to the side here. As I'm looking at the table here. Put your hand up and grab your other hand. So the arm that's down is on the table. I'm sitting perfectly, so my chest is facing that way. I want to push down on my arm. This is called the sleeper stretch. It's a very effective stretch to stretch the posterior capsule of your shoulder. It's not very comfortable, but it's very effective. Interestingly, if you're a tennis player or if you're a pitcher, a lot of times if you've played sports throughout your life, you'll have more external rotation, which is this going backwards in your dominant arm because of all the cocking back and throwing and hitting a tennis ball than you have in your other arm. And you lose internal rotation in your dominant arm. And so the sleeper stretch is a really good stretch to get some of that internal rotation back in that dominant arm. So those are some of the exercises I use. Corner of the room stretch, hang from a doorway, posterior extension with my arms behind me, towel up and down my back, and then finally the sleeper stretch. Let's talk about some strengthening. We're almost at the end of this, so I'm going to talk about There's two groups of exercises I typically do. One is called scapular stabilization. Again, the scapular moves in different directions, and the scapular is the dock that needs to be anchored to the shore. And so scapular stabilization exercises do this. So some things you can do, just even when you're seated, shrugging your shoulders up, rowing your shoulders back, and pull downs. A really effective and inexpensive way to do this is to get a band. Let's take a look. So one thing I can do, I can put my band underneath my shoes. I'm gonna come up here. This is what I get when I do this myself here. I get my bands here, and I'm just gonna shrug my shoulders straight up with the bands while I hold the bands. And again, you can use different weight. You wanna shrug up and hold down. Shrug up and hold down. Again, that's shoulder shrugs with the band under my feet. Over here. Rowing exercise. A great rowing exercise, you can attach this to a door and you can pull back with, again, when a good core position, pull back and really kind of squeeze your shoulder blades together when you do that. Really super effective. Again, you're pulling back and you're squeezing between your shoulder blades. An alternative way to do this is you can put the loop under your foot, under one foot, and I could do some rowing that way, pulling back while I lean over. Hope you're all with me so far. Last one, I'm gonna put this over here, just open the door. You can put this over a door. This is one way to do pull downs in your house. Now loop this over your door. Grab the band, kneel down, and I'm just gonna pull down with both my shoulders. I'm gonna squeeze down and pull down. Again, pull down, very effective exercise for shoulder scapular stabilization. So shrugs, rows, and pull downs should be the base of my scapular stabilization program. Lastly, we're gonna work on strengthening. So we talked about the range of motion, we talked about the scapular stabilization, and then we're gonna work on what are a couple things I can do for my rotator cuff. If you have a little dumbbell, this is 4 pounds, you can use 3 or 5. There's a couple ways you can do it this way. I'll show you real fast. Let's bring this over here. Again, this is me here on the table. Let's see. I'm gonna lay on my side, my right shoulder here that we're working. And I'm just gonna keep a 90-degree angle. I'm gonna keep my elbow tucked in. I'm gonna keep my weight here. I'm just gonna rotate it up while my elbow doesn't move. I don't wanna pick up my elbow. I just wanna rotate it. Like so. And this is working my external rotation. You wanna go to about as far as you can go until you really can't go any further, then lower it slowly. You don't need a heavy weight, 3 pounds, 4 pounds, 5 pounds. These are tiny muscles that you're trying to work. Very effective exercise for external rotation. Another one you can do is called cocking your arm back. So one thing you can do, you can get a little bit, you want to keep your shoulder above your elbow height, and you can get on a table here and just kind of rotate your arm up and cock it back. This is working the external rotators, but in a more functional position, which is my throwing position. Let me give you 2 alternatives that you can do. If you want to try this, actually, let me bring this over here. I'm gonna attach my band now. So you can do it with dumbbells, you can do it with bands. This is, I like this one a little better. So I'm gonna grab this one here. Same thing, I'm gonna start my hand here at 90 degrees. I'm just gonna rotate my arm out. Doubling up on the band is pretty strong here. So I'm rotating out. Again, this is external rotation. Likewise, I'm gonna move this out here. I'm going to work on my pitching muscles. I'm gonna hold this here. I'm just gonna pull back. So the key here, I think you can sit and do this in this cocking position like this, like you did in the table. The idea is it's functional. So make believe quarterback. Make believe you have a football and you're gonna take the football back to kind of throw. Here I got the snap. I'm gonna take the football. I'm gonna cock my arm back to throw. That's the position you want. So I'm gonna get in a position like I'm about to throw. I'm just gonna take it. I'm gonna cock my arm back. And I'm gonna work my external rotators in a functional position while my core is really tight. And this is a great way to work the external rotators in that cocking position. Super exercise. By the way, these bands are very cheap. and they're very effective. Last one, last exercise. So this is really super functional. This is called a lift off. So what I'll have patients do is lay down, face down on the table. So make believe you're swimming. I'm not a big swimmer, but if I was swimming, you're kind of pulling through the water. And that motion back here, where you kind of push the water away, that's the motion you want to get. So if you lay flat and you have your hands here, you want to push back the water and you want to pull from the lower part of your scapula here. So I'm going to take my arm, I'm going to push the water back, and I'm going to lift my arm up like an inch or two. You don't need any weight. I'm going to push up, and you can also push a little bit behind you, but you should really feel this at the lower part of your scapula and your back. And that's going to really help anchor that scapula here. I'm going to sit and do some of these here for you. And pull back. It's called a lift off. So just quickly, we talked about some of the problems with the shoulder. We talked about range of motion. Those are some basic range of motion exercises. Again, you don't need a gym. We talked about scapular stabilizations, shrugs, rows, pull down. And we talked about the rotator cuff strengthening, external rotation, cocking your arm back either with a dumbbell or a band, and then a lift off test. Those are all super things you can do for your rotator cuff. And with that, I'm going to end this. I don't want to take too much of your lunch hour, but I feel like that's enough. And just wanted to say thank you for participating. If you have any questions, I think Leah is going to gather them. I'll be happy to answer them. We can send it along to you. But hopefully this is helpful. And again, if you have shoulder problems, I think this is a great way to start off.
Yeah, thank you so much, Dr. Blue. This was great. And like Dr. Blue said, if you have any additional questions, you can always email us at info@orthonorcal.com or call the office directly at 408-412-8100. Again, the recording of those exercises will be available on our website under News Webinar. And let us know if you have any questions. Otherwise, enjoy the rest of your day, and thank you for joining us today.
Great, thank you all.